Good afternoon, everyone. Thank you for joining us today. I am joined, as you can see, by Jason. He and I will take questions shortly. Before that, though, I'll give an update on where we stand with COVID right now, starting with today's statistics. We are reporting another very sharp rise in cases today. 6,835 positive cases were reported yesterday. That is by far the highest number in a single day so far, and it represents 14.2% of all tests carried out. However, I should also say, for some context, that there was also a record number of tests carried out yesterday. That doesn't entirely explain and account for the rise, but it does give, I think, some important context. 479 people are in hospital currently. That is 53 more than yesterday, and 47 people are in intensive care, which is the same as yesterday. Sadly, a further 4 deaths have been reported in the past 24 hours, and that takes the total number of deaths registered under this daily definition to 8,103. And as always, my condolences go to everyone who has lost a loved one. As of this morning, 4,095,463 people have now received a first dose of vaccine, and 3,629,482 have received a second dose. The vast majority of people over the age of 40, now 95% of them, have had two doses of the vaccine, so are now fully vaccinated. 70% of 30 to 39-year-olds have also now had both doses. For the 18 to 29-year-old age group, 74% have had first doses, and so far 46% have had second doses, although second doses are of course ongoing in that age group. And I can tell you that in 16 and 17-year-olds, where the beginning of vaccination is much more recent, almost half, 44%, have now had their first jab. So these rates of vaccination are positive and continue to give us, even in the face of case numbers such as those I've reported today, optimism for the remainder of our path through this pandemic. We know that if we're fully vaccinated, we are somewhat less likely to get COVID, although, as I said on Tuesday, around a third of new cases at the moment are of people who have been vaccinated. However, even more importantly, we know that being fully vaccinated makes us significantly less likely to fall seriously ill from COVID. That's why the high number of new cases that we are seeing just now hasn't so far led to the same number of hospitalisations that we saw in previous waves of the pandemic. That said, the case numbers that we are seeing at the moment are still a cause for concern. In the past 7 days, we've reported more new cases than at any previous time in the pandemic, although I refer back to my point there about higher levels of testing. But case numbers have roughly doubled over the course of the past 7 days. It's important to point out that case numbers are rising across the UK just now, but after a period of slower increases in Scotland, the rise here is particularly sharp at the moment. That is possibly, at least in part, a reflection of the fact that our schools return earlier with the increased interactions that come with that. And although vaccination has significantly weakened the link between a high volume of new cases and serious harm to health, it hasn't completely broken that link. So even if a much smaller proportion of people who get COVID now need to go to hospital, which is the case, thankfully, basic arithmetic tells us that a small percentage of a large number is still going to be a significant number of people. And indeed, in recent days, we have seen an increase in the number of people in hospital. To give some context to that, last Friday, 312 people were in hospital with COVID. Today, as I've just reported, that figure is 479. And of course, people who don't go to hospital can still suffer serious illness, including long COVID. So the potential health impact on individuals is a concern in itself, but that also will put our health service under further pressure at a time when many staff have been working flat out for 18 months and when we're trying to catch up with a backlog of other procedures. If you recall, at the start of the pandemic and throughout much of last year, protect the NHS was one of our key messages, and it's still something that we need to bear in mind at this stage. So all of this is why on Tuesday, when I last stood here, I described our current situation as fragile. There's no doubt that the vaccines are allowing us to take a far less restrictive approach to dealing with the virus than we did in earlier stages. And we know, of course, that the measures which have been in place for much of the last 17 months have in themselves caused serious harm. They've disrupted schools, hurt the economy, affected well-being. That's why, even although if we are being responsible, which we must be, we can't and shouldn't rule anything out in the face of a pandemic, none of us want to go backwards to even limited restrictions. Of course, we can't ignore the current surge in cases either. My job in times like these is not to be popular, it's to take any decisions, no matter how difficult, that are necessary to keep us safe, and I will certainly not hesitate to do that. In particular, we are currently watching closely to see whether and to what extent we might start to see significant increase in serious illness and obviously in people being hospitalised. So I will continue to keep you updated in the days ahead, but it's worth being clear right now with you that some of the speculation you might be reading in the media is not accurate. For example, we are not currently considering a circuit breaker lockdown. For the moment, though, I do need to stress the vital importance of everyone playing their part in limiting the spread of the virus. The more we all do this, the more chance we have of avoiding the need for the reimposition of any formal restrictions. So, for example, we're asking businesses to ensure that they continue to encourage workers and customers to comply fully with COVID mitigations. That includes wearing face coverings in indoor spaces where required. Businesses should also at present continue to work with staff to support home working where at all possible. It is of course vital for businesses, as it is for everyone, that we do slow the spread and avoid the need for further restrictions, and I'm grateful to businesses across the country who I know are doing so much to help us achieve this. In addition, of course, all of us as individuals have a really important part to play. We all have some control over transmission. So there are 3 steps in particular that we must all take to keep the virus or get the virus under control and slow down transmission. So I want to close by emphasising again what those are and taking the opportunity to remind people afresh of how important it is that we all abide by all of these mitigations. Firstly, if you are eligible and if you haven't done so already, please get vaccinated. I can't stress enough that this is the single most important thing any of us can do to try to keep each other safe. But as I said on Tuesday, the counter to that is every person who opts not to get vaccinated is putting themselves and others at greater risk, and of course is reducing the overall level of population immunity that we might otherwise achieve. There are drop-in vaccination centres in every mainland health board area. You can go to NHS Inform to find out where the one nearest to you is, or you can follow your health board on social media. If you haven't been vaccinated yet, if you've had your first dose 8 weeks or more ago, just turn up at the nearest centre and you will be given the vaccine. If you have doubts about vaccination, go along to a centre anyway, would be my request. The staff, volunteers there will be able to answer any questions that you have and talk you through the process. Second, please test yourself regularly. If you do that, then if you have the virus but you're not displaying symptoms, you have a chance of finding that out before you go out to work or to socialise. So testing yourself regularly makes it less likely that you inadvertently pass the virus on to others. So it is a really important mitigation that we're asking everybody to observe. Again, just to remind you, you can get lateral flow tests free through NHS Inform. You can have them sent to you in the post. You can also pick them up at test centres or local pharmacies. Remember, if you test positive through one of these devices, or if you have symptoms of the virus, make sure you self-isolate and you get a PCR test. Self-isolation remains an important way that we can all slow down the spread of the virus. And thirdly and finally, please continue to follow the rules that are still in place, limited though they are at this stage, and continue to follow all of the public health guidance. That's important for all of us. Even basic steps, wearing face coverings on public transport, for example, opening a window if you've got someone in your house to make sure there is good ventilation. All of these things make a big difference. So please remember, it is still a legal requirement to wear face coverings in certain indoor public places, shops, public transport, and when entering and moving about hospitality settings. It's a simple but really important way in which we can all help protect each other. And more generally, it's important in these current circumstances that all of us think about how often we're interacting with others and with how many others we're interacting with, to think about the risks that we are running when we go out and about, and the basic steps we can all take to slow down and avoid either getting the virus from somebody else or passing it to somebody else. Again, we should all remember, wherever we are right now, that the virus is likely to be somewhere there with you. So meet outdoors as much as possible. It's not risk-free, but we know it is lower risk than being indoors. If you are indoors, try to avoid places that are crowded, and as I said a moment ago, open the windows. The more ventilated a space is, the safer it will be. Even though it's not the law anymore, try to keep a safe distance from people in other households if you can, especially when you're indoors, and continue to minimise direct physical contact where possible, handshaking, for example. And remember to wash your hands and surfaces regularly and thoroughly. All of these things that have been important all along remain important now. In some ways, as legal restrictions on our lives have been lifted, these basic measures become more important. And with the virus transmitting as much as it is right now, it is really important that we all take steps to remind ourselves to do all of these things. If we do, we will help limit spread. We'll make ourselves safer, we'll make our loved ones safer, and we will help make sure that we maintain progress forwards and not have to impose any further restrictions. So please get vaccinated, make sure you test regularly, and please tighten up again on following all of the basic mitigations and health advice. Thank you for listening.